But you also very, very nicely set up the next speaker, because I believe that out of that February 2011 meeting, convened, as I mentioned, by HRSA and some major other players in the philanthropic arena, came a recognition that there was no convening place for advancing the interprofessional education agenda, because we are so very comfortable in our silos. And so after a great deal of study about the right way to proceed, HRSA issued a call for a national coordinating center for interprofessional education and collaborative practice. And I'm pleased to introduce Barbara Brandt, a colleague from the University of Minnesota, who has accepted the awesome responsibility of serving as the director of this new coordinating center. Barbara, thank you for being with us.
Thank you for inviting me here today, the great introduction. Yes, we need a reality check, and this is it. The HRSA award at the University of Minnesota, the designation, it's a leading organization to coordinate the National Center for Interprofessional Education and Collaborative Practice. So it's been less than 2 months, and I'm here to give you a status report. So when I looked at the agenda today and looked at the participants, I felt like the Kevin Bacon game. I'm looking at people in the room, 6 degrees of separation. Only in my case, it's 2 degrees. There are many of you here that I've worked with. You've mentored me over the years, and you're a part of this story and success. There's some of us that in 2006 did not think the field of IPE, interprofessional education, was going to survive, because a lot of interest in it, it actually waned. But there have been lots of historic initiatives, efforts in the last 2 years particularly, that has made this field vibrant again, and this body is representing it. So we're all in this together, and we're in a game changer, and we're in a culture change. So I want to start my talk out, and this is a 50-minute lecture. I promise you I won't give it. Of homage to Hugh Barr, who was actually instrumental in changing my thinking about IPE in June 2008. And really, this thinking is the underpinning for the National Center. He gave a presentation in June 2008 in Stockholm at the Altogether Better Health, and he had a slide up there. And I was asked with Maddie Schmidt in April 2009 to give a presentation to HRSA about IPE. And we were looking all over the world for Hugh at that particular time to find the slide. But what that talk meant to me was, at the time, we were very focused on teamwork and patient safety agenda. And Hugh was pushing our thinking to think well beyond it, that interprofessional education could have a major impact on workforce development. So I sketched out on the back of a napkin, getting ready for that talk, what were all the reasons for interprofessional education, and really thinking that by combining health systems transformation with health professions transformation coming together, that interprofessional education could have an impact on both health and learning outcomes. And in Minnesota, what's important at the time was in 2008, Minnesota passed healthcare reform. We're very aggressively in Minnesota implementing it. We have 197 certified healthcare or patient-centered medical homes, accountable care organizations, and the like. What that is demonstrating, even in the face of an academic health center that has been implementing interprofessional education for quite some time, that a gap is developing between transforming health systems and where we are in health professions education. And this body heard that from Dr. Paul Grundy in August. So that, too, is a focus of the National Center. So this was a graphic that we put in the proposal. And clearly the interface, or the nexus, needing to have a more functional nexus between transforming health systems and health professions education, is the focus of the center. With a new nexus, coming to team-based care focused on improved health and community outcomes. And we focused the proposal on the Institute for Healthcare Improvement, triple aim, or improving the patient experience of care, improving the health of populations, and reducing the per capita cost of healthcare. Now, health systems, I do a lot of talks, I go around and talk. Health systems are using the triple aim as their mantra, and some say the imperative for change in healthcare. Work that I see Mark Ernest over here, Dr. Ernest and I, he's at the University of Colorado, have a funded project by the Robert Wood Johnson Foundation and the Macy Foundation where we're looking at that interface now, and that will become an important prototype for the work. HRSA did set the game rules for the National Center. Leadership, scholarship, evidence, coordination, and national visibility to advance interprofessional education practice as a viable and efficient healthcare delivery model. It is a cooperative agreement. That means we are planning this together with HRSA. I have weekly conference calls with them. Right now, they are helping to connect the National Center with federal agencies that are working on healthcare reform, particularly the Center for Medicare, Medicaid Innovations, which has 104 projects going on throughout the United States, very definitely tied to workforce development in new ways. Transform a siloed U.S. healthcare system and create new healthcare organizations. This was all in the funding opportunity announcement. Facilitate the preparation of a workforce that is fully prepared through structured training and exposure, and operate as a neutral and unbiased convener amongst stakeholders in education, practice, and public policy. Because it's HRSA, it is focused on rural and underserved populations. I serve as Minnesota's director of the Area Health Education Center statewide network, so that was an important underpinning of our proposal. So we are a consortium of practice partners. So in our proposal, we have formed the Minnesota Interprofessional Education and Collaborative Practice Network, where we are actively implementing IPE and practice sites, and we are beginning the process of evaluating those outcomes. That was important in the FOA. So again, it was a little tricky, those of us who put in the proposal, and there's several people here, where we had to demonstrate that we were partnering locally while building a national center. So the University of Minnesota's approach was giving a big idea with mega systems thinking and change. A high stakes game needs a game changer, a bold move. I've talked about the triple aim and the nexus. Your talk that preceded me was the focus of the center. The major focus is on research and evidence. You are quite correct. We've been at this for quite some time. And if Scott Rees was here, he does the research. He has done several meta-analysis, Cochrane reviews. There is very little research and evidence to guide us as to what we're supposed to be doing. So I get asked the question, what is the value added of all of our work that we're doing together? And I feel that if we do not get this part right, 40 years from now, it'll be a fresh new idea. So that is the focus of this center. And again, we have our consortium that we're forming, and we have a national innovations incubator that will be forming to conduct that research. I serve at Minnesota, at the University of Minnesota, on our National Institutes of Health Clinical Translational Science Award in interprofessional workforce development. Coming out of those 60 institutions is informatics. Health informatics is a very important underpinning of the work. So that will become, over time, an important focus of the center. We're moving in two directions. Boy, are we moving. We are working on early wins and immediate actionable items. I just got my HR plan approved by the University of Minnesota 2 weeks ago. And so we're working on short-term impact, talking to a lot of people, trying to understand the environment. I've hired a communications consultant who's looked at all the materials, listened to me talk, making recommendations for even the name of the center, which right now is too long. So starting next week, we will be getting out communications, talking about where we are in the planning. I will send Patricia that email, so those of you who are interested in learning more, signing on to the blog and the like. Starting to have calls, have had calls with the IPEC group, again, talking to many people about their vision and hopes and dreams for this center. We are also working at the systematic strategic change level. And what does it really mean when you set out a goal for the triple aim and national aim? So these are the involved and engaged funders of this center. And it's historic that they have come together and agreed to put their funding into one entity. It's actually quite daunting to think about it. But this group came to the University of Minnesota campus on November the 14th and 15th, and they met with leaders, faculty from the University of Minnesota, and we talked about this center. We went through the proposal pretty in depth, and for me, what was very gratifying was their unwavering support for the vision that was in this proposal. They will be working with me. I will have conference calls with them every 3 weeks. And right now, my team is working on the comprehensive plan to fill out the vision in detail and the budget. Next week, we have an all-day meeting that will be led by the Minnesota Evaluation Studies Institute, which is an institute in our College of Education. We have a pretty deep and long history of evaluation. Many of you know the MPPI. We have a lot of well-known evaluators. About 15 years ago, they developed competencies for evaluation that has been translated worldwide. Canada even licenses evaluators based upon their competencies. So they're taking a look at what the vision is and how can we translate that for interprofessional education and collaborative practice. So they're working with us on that. What their area of expertise is they have a certificate program to train community-based evaluators in what they call low-cost, high-quality evaluation. And again, they're core to the incubator, to the network, and really getting at this rigorous research agenda. This is the methodology framework that we put, can I drink this? Into the proposal. And as been noted already, there is significant uncoordinated activities going on in interprofessional education and collaborative practice. I keep my ears to the ground on this field. Even I am finding little gems on a weekly basis that need to have a spotlight put on them. Trying to get more information in a central location, but most importantly, get clarity through standards, definitions, measures, and protocols, and then use informatics to connect up what we know in patient electronic records to what we're doing in education and practice. There is a project that is going on in nursing. I think it might be just finishing up. The Gordon and Betty Moore Foundation funded the Deep Dive project with the American Association of Colleges of Nursing. The University of Minnesota is partnering with the University of Maryland, and they're looking at 10 sites, I think it's a San Francisco area, where they're linking team training and documenting data in practice. That's the level of specificity that we need in this field. This is the organizational chart, which is changing, the framework for the center. One of the biggest ahas for me is that we need more advisory groups than I envisioned when we wrote the grant. For example, there is no question we need an expert panel, people who have studied this field. Scott Reeves has been very helpful to me in thinking through who that might be. So we're going to have that level of focus on evaluation and research. And then HRSA and the funders were working in and seeking nominations for the National Advisory Committee, which will be strategic in nature. There will be 5 learning collaboratives, one focused on leadership, and that'll grow out of our work in the Nexus, collaborative practice and system transformation. And again, there's a tremendous amount of work going on in this area. We do not need to duplicate it. We need to understand it. Education and training, and again, there are lists of many people in your book today who are doing good work. Research, scholarship, and evaluation, as I've described, and innovative and novel models. And this one, to me, was a passion for me. And those of you who've heard me talk about this, is that at Minnesota, we have protected centers when a good or a new idea is coming up. An example is spirituality and healing. Another is bioethics as clinical consultants, and there are others. And what's happening now is HRSA is connecting us to the CMMI projects. We have a faculty member from the University of Minnesota, Brian Isitz, pharmacy faculty member, who's been tasked to this center for the last 18 months. He will come back to Minnesota and lead this area 50% time. Very important that all this work that's going on in innovative models of practice needs to come into the National Center to understand what are the implications for practice and how do we redesign education for what is a transforming system. And again, there's many other features that we'll be sharing starting next week. So where do we want to be in 5 years? We want America's connected to the world's best thinkers about interprofessional education and practice are fully engaged in the national centers, priority projects, and are recognized for their work publicly and across and within professions. We want our public and private funders and partners are receiving the highest return on investment possible based on the conclusions of our rigorous evaluation process. We want to be models for using technology to achieve the greatest results through the greatest collaboration. Right now, I'm working with the University of Minnesota Libraries, and this too was in the proposal. We have models where they have been convening. One is agricultural economics worldwide. They've been convening as a repository good work. So I'm taking a look at that model. We have another model that's called Ethics Share, which is much more of a collaborative model. I do not know what this is going to look like yet. It needs to link up with other fine efforts that are going on, but a technology platform needs to be part of the solution. And then finally, that we have made significant contributions to improving health outcomes and advancing the triple aim. So I want to end there, and again, I want to thank everyone for inviting me here, and nice to have a reality check and sharing our vision with you. Thank you.
I've never seen anyone give a 50-minute lecture in 15 minutes before and not make my head spin. You do have a plane to catch, I know, but you have about 5 minutes.
I'm here till noon. I'm here till noon.
Oh, terrific.
Yeah.
Would people like to ask Barbara questions about the coordinating center, recognizing that it is still very much a work in progress?
Thank you for sharing that very interesting presentation. Could you speak a bit more about how the learning collaboratives will work, who will be part of them, and what will be their methodology for advancing their particular themes?
We're just taking a look at that right now. So we have a project at Minnesota that's going on in practice sites. We're actually taking a look at the PSC model that's coming out of HRSA. That's one model. So we're actually talking to people now about how they utilize learning collaboratives, what's been the outcomes of them, and that sort of thing. So I think that defining what the structure of those should look like is what we're looking at right now. Yes.
Yeah, thank you very much, and also thanks, Dr. Thier, for the previous presentation. I was going to ask him this, but also, Barbara, I think it's relevant. So the focus on interprofessional education is not an end in itself, and I don't think we spend enough time reflecting on outcomes. And all the things about quality, I don't think we have exactly the same idea in terms of what that means. So could you reflect a little bit about in terms of the coordinating center,
Right.
that first slide you showed, which led everybody
My
puts that
50-minute
up.
lectures.
Okay, my question though was really about, people seem to put that up, but they're really focused on the middle stuff over and over and over again. And I'm believing very strongly that if we don't move to a much stronger focus on the end of the thing, we're going to be right where we are in the next decade.
Right.
So.
And that's one of the things, and that's exactly what the funders were asking me 2 weeks ago. So they want their funding to be a part of success. We were asked about what are the outcomes. Again, focus on the triple aim and working backwards of how it relates to all of these features. They asked me the question, we've been at this for 40 years, what's going to be different this time? So next week, we're spending the whole day literally on this topic. We have a health services researcher who's coming down, who's mapped out for an entire integrative health system what it looks like to evaluate the triple aim in primary care settings. We have the educational evaluators who are there. And then what will come out of that is literally our theory of change or logic model. So we're at that level of trying to get to the specificity that will be shared more broadly for input.
I was curious to know what methods you've identified for disseminating the lessons that you're learning. How are you going to get everybody to?
Well, in the first 59 days, so one of the things, I think there are several things. One is starting to get out with this email so that we help people understand what the framework is for the center, number one. We obviously need to engage groups like this. The IPAC group will be very, very important. So really the partners that are going to come forward to work with the center, I think, are going to be critical with this work. We're putting up a website now, but I really am going to defer to the experts on what is the best methodologies for the technology platform. So there's really good work going on. For example, the MedEd portal is a peer-reviewed for the curriculum. So really taking a look at what works for what purpose. And again, they're pushing me on exactly the same concept of what are the outcomes, why would you do this, not just doing it for that sake. But I think the other piece, and a point well taken in academia, we have to help support faculty in their career development. There was a period of time that I would have told junior faculty to run as far away from this field, that it's dangerous, it's marginal. I'm sorry, Maddie. But now that it's mainstream and I think it has legs and it's tied to thinking about rigorous outcomes, it is a career goal, and we need to be mentoring the next generation of faculty researchers linked to practice.
We have time maybe for 2 more questions. I'm going to call on Maddie and then defer to Afaf. I'm sorry, I apologize to the others.
Barbara, one of the discussions that we've been having is the importance of bringing learning theory to the work that we're doing, that's been a missing piece. And I know that your own background is tied heavily to that. So could you speak to where that sits in the coordinating center's vision?
That's 2 50-minute lectures. So yes, that will be up in the learning collaboratives. And as Maddie knows, my background is continuing professional development in the health, very specific to the health professions, and very specific to cognitive learning research and science. We haven't even touched the surface of this topic. The same neuroscience that we're funding in academic health centers is a source of information for us. There's a terrific book by Kathy Davidson called, I think it's Now You See It, boy, we are not using the research that's coming out. So I see that coming through particularly the education and training collaboratives. I think there's conversations that need to be had about how the competency-based approach applies to that kind of thinking. You know, one of the philosophies that we're working on in Minnesota is how do you reframe the thinking about this work? So for example, working with the University of Toronto, they have something called the Weave, or interprofessional facilitation. So really thinking very differently about the rational model of education and how can we mine practice for learning. So again, this is a passion of mine. You will hear it, and I think that's going to be where another piece of the scholarship needs to reside.
Barbara, thank you so much.
Thank you.